Are you okay?
No, I'm not. I can't stand it. I'm in so much pain.
All right, well, let me get back here. Come on, I've got someplace you can sit down, okay?
Oh my God.
Have a seat right here.
Can I hold on to it just a little bit? Oh, just a little bit. Just a little bit.
So you want to tell me what brings you? I can obviously see it's the pain.
Yes.
How long have you been having this pain?
Oh, for a little while now. 3 months? 2 months?
Can you tell me what it is on a scale of 1 to 10, or 0 to 10, 0 being the least and 10 being the worst?
I'd say like a 9 or 7. 7 to a 9.
It goes to a 9.
Yes.
It comes and goes?
Yes.
Okay, well, can you show me where it is?
Oh, I don't know if I can.
Can you point to it?
Right here.
Right back there?
Yes.
Okay, does anything you do help it make it feel better?
You can help me recline.
Okay, we can do that.
Oh, you gotta go
Maybe
slow.
you can scoot down that way a little bit.
Try to do it.
Okay.
Let's do it really quick.
Really quick?
Let me do it by myself.
Okay.
It's better that way.
Okay. Can you get your legs up?
I think I can. I'll do it quick.
Does that feel better?
Yes.
Okay.
Much
I'll
better.
be right back in here. I'm going to take your vitals, so I'm going to go out and get my stuff, and I'll be right back, okay? All right, Mrs. Berry.
Yes.
Correct. So, what are some things that you do? What do you do for a living?
I'm a secretary.
Mm-hmm. We got your vitals. Your vitals look pretty good. Your blood pressure was 117/72. The pain you said is a 7 to 9 on a scale of 0 to 10.
Well, now it's a 7.
Okay.
9 about now. Reclining is 7. 9, you know, when I try to move, with 10.
Okay. Do you take any medicines at home?
Oh, yes. At home, I take well, whatever the strongest thing I can find. So it's like between aspirin. I take that because I think it was, you know, helping with my blood too. I take Exogen. That one helps me.
Excedrin?
That one. Yeah.
Okay.
And I use warm compress on it sometimes.
Warm
Yeah,
helps. Have you ever tried cold?
No. The cold make it worse for me.
Okay. So no cold. Can you tell me how old you are?
50.
Okay.
Young 50.
Do you have any kids?
Yes.
All right. How many do you have?
3.
Okay. That's nice. You said a while. Do you have a date? Like how long?
Well, I was at work and I tried to pick something up and I felt a little tweak and then, it kind of go away. I went home, I took something, I slept, and then ever since I've been having a little pain here and there. But I'm so busy, I ignore it.
Okay. Can you tell me some things that make your pain worse?
Well, bending,
Mm-hmm.
sitting in a position for too long. Sometimes if I reach too far or too out of
This way or this way?
both.
Both of them?
I think it's bad posture.
Okay.
And I have osteoporosis in my family, so it could be both.
There's some osteoporosis in your history?
Yes,
your family's
ma'am.
history?
Yes, ma'am.
Okay. So how do you find it to be able to do your daily things like tying your shoelaces?
Exogen. Oh, they have these cool things that I put in it. Help me slap my shoe on.
So is it easy to do?
Mm-hmm.
Okay. What about getting your clothes on or anything else? Do you have any trouble?
I try to wear loose stuff so I don't have a lot of pulling and tugging. I know you can tell by what I'm wearing now, but I got help today.
Oh, okay. So, all right, well, I'm gonna go get the doctor to come look at you, okay? And we'll let him.
Thank you, ma'am.
Good morning, Mr. Kana. Here we have Mrs. Berry. She's 50 years old, single, has 3 children. She's 200 pounds, 5'5" height. She has no prior surgical history. She has a family history of osteoporosis. She's in here today because of lower back pain. She came in to the ED with her hands holding her hips really stiff. Her head was slumped. She states that the pain has been affecting her for more than 3 months. It's so severe that she has trouble getting up out of any seated position and finds it difficult to conduct her ADLs. Some of her signs and symptoms: muscle aches, sometimes shooting or stabbing pain. It worsens with bending, lifting, or walking. Reclining helps her. And she's reporting a pain of between 7 and 9. 7 when she's sitting, 8 or 9 when she's standing up. And here are her blood tests and her x-rays.
All right, Mrs. Perry, so we got a CBC around you to make sure you don't have any infection.
Okay.
Okay, it came back clear, so you don't have any type of infection going on.
Yes, doctor.
All right, so typical course that we're going to prescribe you is just some NSAIDs to help with the inflammation and the back pain that you're experiencing right now. Or have you follow in the future. Okay. So you can talk to your nurse about your discharge instructions.
All right, Mrs. Berry. So I hear that the doctor prescribed you some pain medicine. He also has in here, he wants you to go for an x-ray, and if they need anything else, like an MRI. I don't think that they'll need one, but if they do. So he prescribed you some medicine, and he prescribed you some exercises, okay? So medication is ibuprofen, Tylenol, they're NSAIDs, they're anti-inflammatories to take some of the inflammation down to help your back not hurt as bad.
Prescription.
No, it's not over the counter, yes. They start small and then they work their way up, okay? You want to make sure that you don't go over what he's asked you to take, okay? Usually on the bottle it says how much to take, so make sure you read the directions, all right? You don't want to take too many because you don't want to mess up any other organs in your body, okay? And as far as some of the exercises, when you're going out to garden, make sure that, you bend down with your knees and not your back, because this can hurt your back, okay? Make sure you're standing with your posture, your shoulders back a little bit.
I'll try that when I take my medication, and I'll do that.
All right, we're gonna have physical therapy come in and talk to you about some more exercises that we can tailor for you, okay?
Can you just schedule an appointment for that one?
I can.
So I can just get some rest, please?
Yes, I will.
Okay.
All right, thank you, Mrs. Berry.
Thank you.
If you need anything, let me know.
I will.
Okay. Okay.
Let's look at the calendar.
Right,
Yes.
right. All right, so we have questions for our classmates. So the first set:
All right, what factors contributed to this patient's lower back pain?
her age, her posture, her BMI, she's obese, her lack of exercise, psychological factors can affect it, and smoking can affect it as well.
What relieves her lower back pain for her?
She uses muscle, NSAIDs is what she said she uses, but there are some other things that they can do to relieve back pain, such as this, muscle relaxants. There's back exercises they can do. There's also acupuncture, reclining, warm compresses, sometimes cold compresses help other people.
Okay. More back exercises
Yes.
to strengthen her back, so
Mm-hmm.
improve the muscle tone. All right. How exactly does smoking contribute to lower back pain?
So smoking, when you smoke, it causes your blood vessels to constrict, and the lack of oxygen is not getting perfused enough, so the circulation is decreased.
Makes sense. All right, and lastly, based on the information provided, how would you classify her lower back pain?
Her lower back pain is chronic because up to 4 weeks is acute, and afterwards it becomes chronic.
Hers has been 3 months.
Hers has been 3 months.
2 months.
You said 3. Maybe 2. 2.
Just 3 months is
It's a long time to go with pain.
3 months is chronic.
Mm-hmm.
3 months later, Mrs. Berry returned to the ED. This time, she has radiating pain down her buttocks, her right leg. It has been preventing her from conducting her daily activities. She states that the pain is so severe that she's experiencing tingling, numbness in her lower leg and down her foot. This morning, she was doing gardening and threw her back out when she tried to stand. Her daughter's here with her today in the ED, and Mrs. Berry is having problems standing erect.
Okay, thank you. All right, right this way, Mrs. Berry. Right this way.
Oh, I remember you from the last time.
Yes, I
I'm
remember
here
you.
again.
I see you're back again.
Oh, and with a pillow.
A pillow. Is the pillow helping?
Well, I'm using it to kind of hold. It feels like my spine in places.
Have a
It's like
seat.
it's falling down.
You're not falling down. Real slow. There you go. You got it.
Oh, you know the routine. I gotta wait till first.
That's fine. So you're back again. I can see that your pain is probably a little worse.
Oh, yes.
Is
It's a 10.
It's a 10. Okay. Let me get your vitals. We took her vitals.
I'll put her legs up in the meantime.
All right. So, did you try the physical therapy?
Yes.
And did it work?
Yes. But then I thought I was cured. And I went and did gardening with my daughter outside. I tried to stand.
Do you ever, when you do your gardening, tell me how you do your gardening.
I think you're gonna judge me.
I will not.
It was just
I will
stupid.
not. I will not. Do you sit on a stool or anything?
Oh, I should have sit on the mat or something. But what I did, I bent over, slouched my knees.
So
I was
you
just
were
trying
bending
to
over with your back?
Yes.
So we need to remember to bend with our knees because we want to keep our back.
A squat position.
Yes.
But I think for years of bad movement,
It's not even, you don't even think about it. I understand.
told you were gonna judge me.
No, I'm not judging you. So your daughter was there, you said.
Yeah,
And
she's in the waiting room.
She's in the waiting room, okay. Well, it's a good thing that she's here. All right, I'm gonna go get the doctor and have him come in and talk to you, okay?
Okay.
And I'll
I'll
be seeing you in a bit.
Okay.
Dr. Kana.
Yes, ma'am.
Hello, Dr. Kana. Here we have.
How are you doing, Mrs. Berry? I'm
Mrs.
feeling so
Berry.
well
See you
today.
again, doctor. Yes. Something's going on with my back, doc. Please fix me. Please.
She's back again. Her pain is a scale of 9 out of 10. Her blood pressure's gone up a bit. It's 150/92. Her heart rate is up a little tiny bit. She tried her physical therapy, the NSAIDs.
And it worked until I was stupid to go do gardening and couldn't stand up.
Not doing the best I do.
She had an x-ray and an MRI like you asked, and here are the results.
All right, thank you.
Now we'll be back.
All right.
Doctor, please give me good news. Don't tell me there's something going on with my back that's gonna incapacitate me for a long time.
Well, obviously there's something going on. You wouldn't be here, right? All right. So your X-ray and MRI found that you have moderate degenerative disc disease.
Huh?
Well,
That
means
sounds like a lot of D's, doctor.
it is a lot of D's.
Oh,
A triple D.
Triple D. Okay.
Yeah.
Okay, what is triple D, doctor?
All right. Well, first let me tell you about your MRI findings. Images showed that you have DDD, like I said, at 2 different locations, L4 to L5, which is lumbar.
What is L4?
L means lumbar. It's part of your spinal column. It's the vertebrae that we're referring to.
Huh?
I'll show you here soon on the display. Okay.
Huh?
You also have a herniation as resulting on your pain. Okay.
What, doctor?
Well, I will explain that to you.
It
as well.
sounds like a lot of stuff.
Oh.
I can take this. This is all my fault.
Let me show you here what's going on, okay? Alright. So, you see these flesh colored discs in here?
Yes.
Okay. Yours are getting smaller than they should be, okay?
Yes.
This occurs with overuse, age, various conditions can lead to it, okay?
Okay.
Now, once they close down, things can pinch, including your nerves, which is some of the tingling and pain that you're having. And these discs can also slip out of place from entering the vertebrae. That's called a herniation, we said that you have.
That explains my position.
Yeah, because every time you move, it's just pinching more, so.
So, doctor, how do you cure that?
Well, there are various treatments available.
Okay. Treatment, no cure.
Well, you can't really cure this, but you can manage it.
How do you do that, doctor?
Well, some of the things that we typically do is you can see chiropractor. Okay? And train that and get a massage to remove some of the tension on the muscles around that are helping constrict, make that worse.
Doctor, my husband tried doing that. Well, not really my husband, but kind of my boyfriend. But no, doctor, no. I have to see somebody, an expert.
Well, yeah, you should
But I
see
can
a
get
professional.
Yeah, I'll get up. Okay, that sounds good.
Well, we can refer you like that.
Yes.
You can also get physical therapy to help increase your flexibility and your strength in your back. That's just going to include exercises to build up those muscles.
Yes.
Okay. Then NSAIDs are the typical course like you've been on, but we don't the dose as necessary to try to relieve some of your symptoms.
No prescription, doctor, because it seemed like the NSAIDs are not weird. It's kind of like my body's getting, how do you say it? Maybe immune to it?
Tolerant.
Oh, yes. That's your word. I say immune.
Okay. I understand what you mean. Well, any type of treatment is going to involve multiple approaches to try to just minimize your pain and increase your quality of life. Okay.
Okay.
All right. So we can also give you some muscle relaxants to help reduce that tension on your spine, like we talked about.
Yeah.
Okay. Sleep aids, so you can actually get some quality sleep.
Oh God, doctor, I could hug you right now. I need sleep.
Yep. If you're amiable to the idea, spinal injections of painkillers as well are a possibility.
I had that one time. I had to come in a couple times to get it. It worked well, but I didn't think my back was that bad when I was doing it. So maybe I could try that.
Okay. Surgery is an option as well.
Oh no, doctor, you're not coming nowhere near this. I'll take the other stuff you told me about, not this surgery. No.
Okay.
I'll take the other stuff, doctor.
All right. Well, I'll talk to your nurse about that and get you the proper referrals. Okay.
All right, give me something now, please, doc.
Yeah, I'll get you something.
I'm not a drug seeker, but I need something, doc.
I can see that you do. We'll get you something. Okay.
Thank you, doc.
All right. We'll check back in say 3 months to see how you're doing.
All right.
Okay?
Thank you, doc.
You're welcome, Mrs. Berry.
I'll see you hopefully not soon.
No, hopefully not.
All right. Thank you.
Okay.
So now this is the end of our degenerative disorder, leaving from lower back pain to DDD. And this is our final questions. And question number 1, What sign and symptoms would flag this change as more than just chronic back pain?
Her radiating numbness down her leg into her calf and down the right side of her foot. That's what flags it as degenerative disc disease.
Question number 2, what is another test that could be done to determine if this patient is just having an episode of lower back pain versus something worse?
There is a test called the straight leg raising test. So what we do is we lay the patient down flat, okay? The bed's very big.
It's not doing anything.
It's not doing anything. So pretend she's flat, okay? We're gonna lay the patient down flat and we're gonna raise her leg that she's having pain under 60 degrees, okay? And if she complains of pain radiating down the leg, it indicates that there's a disc problem, which is compressing on a nerve, which is terrible. Okay.
All right. Question 3, what are some treatment options for this patient?
Surgery. She has surgery. That's like, of course, the highest one. You always want to try everything else first. NSAIDs, rest, exercises. There's a bunch of exercises that we can do to help her alleviate some of that tension and pressure on her spinal cord. There's muscle relaxants that she could take. If she's depressed, they'll prescribe antidepressants. Some people that are depressed, it
Has severe pain,
yes,
pain issues can become depressed.
There's also a steroid injection that they can do, and physical therapy. Physical therapy will help with those exercises. They'll create an exercise program tailored specifically to that patient. Okay.
What nursing diagnosis would you give the patient?
We agreed upon risk for falls, just because it's obvious one. There's a bunch that she could have, but one of the main ones would be risk for falls due to her numbness and tingling. She's not
Lack of sensation.
old, but
Yeah.
if she doesn't have the sensation, she can fall.
And also with severe pain, and if the patient has fear or anxiety from the level of pain,
She
the
can't
patient
stand up straight.
will be hesitant to move, and if they move and feel like sharp pain, they'll probably just flinch or fall, or something can happen.
And her standing up straight, her center of
And
gravity
proper
is
gait.
Center of
is
gravity
different.
is
Yeah,
up.
her
Yep.
gait,
Her
too.
gait's up.
Uh-huh.
What nursing intervention would you include with your diagnosis?
Teaching her back exercises, stretching, resistance training, home safety. Is there rugs? About asking her about home. What does she have at home? Are there rugs out that she can trip on? Toys from grandchildren? Anything else that, like steps, small steps, that what if she misses one of them and falls down?
Probably they'll have to install like grab bars and stuff in the house.
Mhm,
have
in the
like
shower.
Or something.
Make sure we try to maximize on the referrals that we can do for everything as well.
Yes. All right. Heat or ice. Some people prefer heat. Some people prefer ice. And shoe changes. Her shoes could have heels, and
Not
she doesn't
appropriate.
regard it as heels, and that's not something you want with degenerative disc disease. You want a sturdy, flat shoe. As a matter of fact, they actually have shoes specifically for lower back pain as well as degenerative disc disease. And the only other one I have is if they're in the hospital for any amount of time, you want to do like a skin assessment to check if they're sitting in one position for too long. It could be a risk for skin breakdown. So I have skin breakdown. You ask her what kind of bed she's on. Maybe they could change the type of bed to like a gel or
Mattress, yeah.
a different
Change position.
Mhm.
That's
Use
a
a
good one too.
butt pillow to get off of that, to take her some of that pressure off. That's all I have.
And frequent change in position will help with mobility, and the patient should probably recommend range of motion exercise while they're in bed. So this way it will help with their increase their mobility, and also decreases the risk of other infections like pneumonia, and while they're in the hospital.
All right, thanks.